The next one on the list, which I feel is probably the most common, is what's called a cervicogenic headache. So it's a headache that comes from the muscles and joints of your neck, and it refers pain into the head. So the head and the neck come from the same area of development when you're a fetus. So they come from the same kind of little pocket that develops into your head and neck. So they share a lot of common pathways. Your neck tells you a lot about where you are in space, and it also can refer pain into your head. And depending on which muscles are involved, it can refer pain to specific areas. So based on the location of a patient's headache, I often know what muscles and joints I'm going to check to be able to rule in or rule out a specific type of headache. With a concussion, you also will get a whiplash injury pretty much 100% of the time. Concussion takes a lot of force to happen. Whiplash takes a small amount of force to happen. Anytime you're going to get a large amount of force delivered to the head, you're going to get that small amount delivered to the neck. So studies have shown this, that 100% of the time, every person that gets a concussion will also have a whiplash that's associated with it, or some sort of neck injury. You may not even feel the neck injury because right now you're focused on your head. But the symptoms of whiplash and the symptoms of concussion are the exact same. Headaches, dizziness, nauseousness, balance impairments, visual disturbances. Your neck tells your brain a lot about where you are in space. It coordinates movement of your eyes. So whenever your eyes are moving, the muscles of your neck are also moving in coordination of those eye movements. And so this communication is happening throughout your sensory systems. So the neck can cause dizziness, and the neck can also cause headaches. And listen to the characterization of cervicogenic headaches. Pain is generally unilateral, meaning one-sided, same as migraine. Pain can also be accompanied by nauseousness, vomiting, photo and phonophobia, meaning light and noise sensitivity, same exact qualifications as migraine headaches. And this one can last weeks to months if it goes untreated. So those of you that say, I've had a migraine for 3 weeks, you likely have a cervicogenic headache, meaning a headache that is coming from tightness in the muscles and joints of your neck. When a muscle is tight and sore, you might feel it in that muscle, but you also might feel it up here. So right now, this headache that I woke up with this morning, that's in my front right temporal and frontal area, when I push on the right side suboccipital muscles and my C2, C3 joint right there, I get the headache to increase right here. Okay? There's nothing wrong with right here. It's right here. And I push on that and I feel that what's called referred pain. So referred pain is pain that's felt somewhere else, but the origin's actually in a distant or other part of the body. The brain is weird like that. It's not good at picking up this deep aching pain and where it's coming from. So treatment for these types of headaches is manual therapy, getting treatment of the soft tissue. So active release type therapy is something I do with my patients quite frequently. Another one is acupuncture, so treating certain muscles, right? And like I said, certain muscles will have different referral patterns. So if it's this muscle right here, you might have pain in the face. If it's the suboccipitals, you might have pain in the forehead or even right behind the eye. I guarantee a bunch of people listening to this right now saying, I have headaches that are like in my eye. And they'll get MRIs and CT scans, and they'll be thinking they have some sort of tumor in their eye, and it'll be crazy, but yet all it is these suboccipital muscles, and if you treat those muscles, the pain will go away. It's quite easy to do. Another thing is rehabilitation, so a good PT or a chiropractor can provide you with some rehab for this to help strengthen the neck, because a weak neck is also a tight neck and a dysfunctional neck, but also for proprioception, meaning movement of the muscles and joints to make sure that the things are coordinated and you're moving in a proper way, because if you're not, that creates tightness in certain areas, which will then refer pain into the head. This is just food for thought, because I just had this thought come into my brain. The brain itself cannot feel pain. So oftentimes people with concussion will have headaches and they'll think it's their brain. The brain, however, does not have pain sensors in it. So you could take off somebody's skull and poke their brain and, make them do funny things, but they won't feel pain in the brain because the brain doesn't have pain fibers. So how can we say or assume that a concussion-related headache is due to the brain itself experiencing pain? Because the brain itself doesn't have any sensors to sense pain. So the headaches are likely due to other, possibilities.